Seasonal flu cases have reached a 15-year high, filling hospitals, closing schools, and causing an estimated 19,000 flu-related deaths in the U.S. so far. For the first time since the COVID-19 pandemic began, flu-related deaths have outpaced those from COVID-19, signaling just how severe this season has been. Alongside the flu, RSV, norovirus, and COVID-19 continue to circulate at high levels, overwhelming hospitals and straining healthcare systems already stretched thin. In some areas, temporary triage tents have been set up to manage the influx of patients, as intensive care units struggle to keep up with demand. If the current trend continues and another peak hits in March, the impact could be even more devastating. This year's flu season has been particularly unpredictable, with multiple waves of infection and the simultaneous circulation of both H1N1 and H3N2 strains. Typically, flu seasons follow a more consistent pattern with a single peak and one dominant strain, but this year has been different, making it harder for healthcare providers to anticipate and respond. Adding to the challenge, preliminary data suggests that this year's flu vaccine may not be as well matched to the circulating strains as in previous years. While the vaccine still offers some protection against severe illness, a lower match could mean higher rates of infection and more hospitalizations. One of the biggest concerns is the significant decline in flu vaccination rates. Fewer than half of Americans have been immunized this season, and vaccination rates among young children, one of the most vulnerable groups, have dropped below 46%. This decline is a major factor contributing to the surge in cases. Many people may have skipped the vaccine due to pandemic fatigue, vaccine skepticism, or simply underestimating the severity of this year's flu season. The result is a population with weaker immunity, making it easier for the virus to spread and cause severe illness. Compounding the problem is the lingering immunity gap created by pandemic-era precautions. During COVID-19 lockdowns, social distancing and mask wearing dramatically reduced flu cases, meaning fewer people were exposed to the virus and developed natural immunity. Now, with those measures largely abandoned, the population is more vulnerable than before, allowing the flu to spread rapidly. The unusually cold winter has also played a role, forcing people indoors into close quarters where the virus thrives. Despite these challenges, there are still steps individuals can take to protect themselves and others. Practicing good hygiene, such as frequent hand washing, can help reduce transmission. Those at higher risk, including the elderly, young children, pregnant women, and immunocompromised individuals, should consider wearing high-quality masks in crowded indoor spaces. Maintaining a healthy lifestyle, getting enough sleep, eating well, and staying active can also strengthen the immune system. However, the most effective way to prevent severe illness is through vaccination. Even with a potentially lower vaccine match, the flu shot remains critical in reducing hospitalizations and deaths. It won't necessarily prevent infection, but it can make symptoms milder and keep people out of the ICU. Since flu season is expected to last at least another month, getting vaccinated now can still offer protection. The current surge serves as a stark reminder that flu is not just a seasonal inconvenience, it is a serious public health threat. Hospitals are already overwhelmed, and with another peak possible in the coming weeks, the situation could worsen. Public health officials must work to increase vaccine uptake, improve preparedness for severe flu seasons, and educate the public on the dangers of underestimating the virus. If the flu continues to spread at this rate, the consequences could be even more severe than what we have seen so far. Taking preventive measures now is essential to protecting ourselves and preventing further strain on healthcare systems.